And welcome back to Body Beautiful. I'm Janelle Marie. With us today, plastic surgeon Dr. Joseph Mele, and we're talking everything you want to know about plastic surgery. And you know what? We rarely hear about this. We just talked about breast reductions in women. So what about breast reductions in men?
Also very popular.
Yes, and so how is that done differently?
It's different because we're not usually dealing with as much extra skin.
Oh,
so
right.
Usually the breast tissue there's a little bit there, but enough to be annoying.
Yeah,
it may be sort of global, where the whole breast is enlarged, or it may just be right under the areola, where that part sticks out.
Oh, okay.
And so there's all sorts of different procedures depending on what the problem is and how much needs to be, corrected.
Do you do liposuction in that area with men?
Yeah, so the most common ways are either with liposuction or what I call direct excision, where you make a little incision right around the areola, same place we make the incision to put implants in, because it hides really nicely, and just take out that really fibrous, firm tissue. Because sometimes it's so firm, the liposuction it won't take it out.
We've got some pictures. Let's take a look at the first picture. There we go.
So here's someone obviously in great shape, bodybuilder. The nipple areola area tends to be protuberant, so it looks kind of pyramidal. And then afterwards, it's kind of sucked right to the shape of the muscle. So we've gotten rid of that extra tissue. And most commonly, the extra tissue is at the bottom of the breast.
Wow, that's incredible. Next picture.
So here's from the front, a little harder to tell, but in this gentleman also had kind of cone-shaped breasts.
Yeah,
the nipple was actually looking a little bit large, the areola was a little stretched out, and it's a matter of just taking away that area. And in these cases, often I can just make that incision, take it out, and do nothing else.
Yeah, that wasn't a big deal.
Not a lot of extra fat.
Most popular procedures for men that come into your office?
This is always in the top 5.
Always the top 5? That's what I figured.
In the summer, I'm doing 1 or 2 of these a week.
Oh, really?
It's pretty common.
Oh.
So here's some much bigger problem. If you look at the left side, he's had a gynecomastia surgery before. He has a big dent there.
Yeah, I see
too much tissue was removed. This is a guy who's lost a lot of weight, so he has a lot of loose skin. And in those situations, when you take out tissue, you either have to be very, very meticulous, or you have to remove some of the skin. So he actually has a scar that runs underneath his breast, like we do for the breast reductions for women, so I can remove that extra skin. And then had to use a flap of the skin underneath in order to fill in that area where it's indented. And both the nipple itself had kind of collapsed on itself, so now it's all flat and smooth where it used to, like it used to be.
Beautiful job. Looks great.
It's more of a revision, but I like a challenge once in a while.
Got a phone call for you.
Okay.
Karen in Ukiah. Karen has a problem with implants. Karen, are you there?
Yes, I am.
Hi, Karen. Ask the doctor your question.
Okay, my question is, I had 2 breast implant surgeries.
Okay.
And my my second implant surgery, I went for a larger breast, went from a D to a double D.
Okay.
And the problem was my areolas for my first implant, and just by nature, were really huge, so they were kind of falling. So I decided to get new implants with a cone lift. And I'm 48 now, and my breasts look like cookie cutters because the doctor removed the nipple completely and put them back on. Even though the breasts are still standing up, they look like cookie cutters. Is there a procedure that can be done to make that go away?
Probably. It's hard to tell without seeing you. Because, like I said before, it's not common to remove the whole nipple in the areola. It would be like a skin graft in that case. And most commonly that's done for very, very large breast reductions when there's a really long distance between the nipple and the blood supply. So in the cases where we're just doing revisions, we tend to just remove skin from around the areola and push it around with the breast and remodel that scar. The scar can be changed. It certainly would require reopening the scar around the areola. May have to open up the vertical portion too.
All right, good questions, absolutely. Great day on Body Beautiful. We got to go though. I'm so sorry. It always goes so darn fast. If you want more information about the doctor, Dr. Mele, 925-943-6353, or check him out on the web, drmele.com, sanfranciscobreast.com. Wonderful day on Body Beautiful. Thank you for joining me, Dr. Joseph Mele. You're always fantastic.
I like being here.
We'll see you next time on Body Beautiful. Thank you for joining us.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.